Hi and welcome to this brief education video on the differences between acute and chronic pain. There are many different types of pain. Acute pain is defined as pain lasting very short duration, normally less than 3 to 6 months, and we would expect an acute pain problem to be the result of a tissue injury, such as a sprained ankle or a fall and fracture to your wrist. The body responds to tissue damage through a process of inflammation. This is the body's first part of its healing response and is vital to keeping us safe and keeping the body fit and healthy. Inflammation, though, does bring a downside to it, and that is it changes the sensitivity of your nervous system. The signals and the messages that your nerves were sending become much louder and much quicker to respond. What does this do then? Well, acute pain makes us take action to protect ourselves and keep ourselves safe. It might be that we stop moving the injured area and we hold it still and we protect it. If it's the ankle, for example, taking the weight off or using crutches. As we said, this is protective in nature. It keeps us safe. It's just the body doing its thing. Healing responses. Okay, we know that the body will heal in a particular way. For skin, muscles and tendons, this can be a very short period of time. Days for skin, up to 12 weeks for muscles and harder tendons. Our bones, our discs and our nerves, these take a bit longer, and we can expect them to be a little bit sensitized up to around 6 months. During this period of time, your doctor or your pharmacist might prescribe some medications, and these can be helpful in relieving the symptoms and allowing you to try to keep going with your normal daily activities. In most instances, the body will heal. We will begin naturally to return to our normal movements and activities, and life starts to get easier again. In some instances, the nervous system can stay stuck in this sensitized state, and this can continue to prolong the pain experience that you might be encountering. Pain that's gone on longer than 6 months is referred to as chronic or persistent pain. Sometimes the symptoms aren't so predictable and they can fluctuate. Well, there might be days where you feel okay and some days where you feel terrible. And there might not be an obvious reason why this is the case. In most instances of persistent pain, the tissues are no longer injured, and this is a function of the nervous system staying stuck in its heightened sensitized state. We said earlier that acute pain is protective and helpful. Unfortunately, chronic pain can be quite unhelpful and overprotective in its cause or its mechanism. We don't completely know why some people go on to experience persistent pain. We do have some evidence, though, that suggests that these following factors contribute to keeping the nervous system sensitized. For example, overactivity. We know that people try hard to continue to engage with the activities of their life and do the things that they really love to do. This overactivity can sometimes lead to keeping the nervous system sensitized. Underactivity. When we protect the affected area, this keeps us safe in the short term, but in the long term can lead to deconditioning and continuing to keep the nervous system sensitized. Stress. We know that pain can be stressful, and we know there are lots of other wider life stresses that can contribute to the pain system staying stuck in this heightened state. Sleep. If we're not sleeping well, whether that's due to pain, whether that's due to having a busy mind related to the other stresses going on in our lives, we know that poor sleep contributes to keeping the nervous system sensitized. When we stop doing the things we love, this can really impact on our mood. Medications, we know they can be really useful in the short term for acute pain, but in the long term, especially some of the opioid medications, these can be quite unhelpful and contribute to keeping the nervous system sensitized. It's human nature to seek a cure for difficult situations and the suffering that we might be incurring. And not quite often you'll be referred for investigations or offered different treatments to try to help you relieve yourself of this persistent problem. Unfortunately, continuing to seek these investigations long term will often contribute to further suffering and keeping the persistent pain problem going. Managing persistent pain requires a different approach, an active approach to managing your own situation and making lifestyle changes. We start with education, and that's what you'll hear with this module today. Understanding how the pain system works can be really helpful for allowing you to move forward and make changes in your life. Movement, exercise. We know that pain causes people to stop moving and to protect the area. And again, beginning slowly and steadily to get fitter, stronger and more active can be really helpful. Stress and managing our stress is very, very important. And in the service we might look at different strategies such as mindfulness to help you manage some of the stressful situations you might encounter in your life. Tidying up our sleep routine, making sure that we're doing the best that we can to be ready for sleep. And really focusing on getting back to a valued life, working on doing the things that are important to you alongside your painful situation, rather than focusing on just the things that have to be done in life. There's some very useful resources available on the internet, and in particular YouTube. So if you were to go onto YouTube and put these search headings in or these titles in, you'll come see some very, very helpful and informative videos which will help complement what we are listening to today and learn more about managing a persistent pain problem.